then, you know, we'll have it, so.
Okay, so this would be in a psychology class. The students would just have gotten done with the social psychology unit. So we kind of would have already covered ethics, ethical guidelines, you know, when you do have participants, kind of stuff we do with that. And it would be this would be actually the beginning of like a mental illness structure lesson plan type of thing. So the students, this was like the third day, so they've already gone over kind of like the history, you know, different stuff that happened in the past, like the first mental hospital in Bethlehem. So they already know that. Do you want me to say my objectives?
No, I don't mean, hopefully we can discern those as you go.
Okay.
Anything else you want to hear?
Good. And they would obviously be like high school seniors, juniors, all right, so first of all, I just want you guys to take a minute and look at this picture. Just take a couple seconds, kind of figure out what's going on, kind of figure out what you think the picture would mean. You guys can talk to each other if that helps. All right, so what do you think is going on in this photo? So what do you think this photo is depicting?
Mental illness treatment.
Mental illness treatment. Do you think that's mental illness treatment now?
No.
In the past?
Yes.
All right. So what kinds of things? So look at the first picture. What do you think is going on? The first one upper left.
They're spinning.
They're spinning it. Yep. How about the second one?
Sensory deprivation.
Sensory deprivation. Yep. And the bottom one?
Mm-hmm.
Yeah. Yeah, like keeping them in a cage. All right, so do you guys see any emotion in these people? Either the person giving the treatment or the person receiving the treatment?
No.
None? None at all? Not really anything going on there? A little frightened maybe?
Yeah.
Doesn't really know what's going on? Yeah, exactly. So by the types of treatments that you guys see here, how do you think mental illness was viewed in the past? Like when it first became seen as mental illness? Physical? Yeah. So do you think people thought it was a good thing?
No.
Good thing? Okay.
I can cure these things.
Yeah. Curable. How do you think that they thought it would be cured?
They're uncomfortable situations.
Yeah.
Torturing it out of them. Yeah.
So they thought it could be cured. How do you think they viewed people with a mental illness? So somebody who is acting different from you because they have a mental illness, or what they see it as a physical illness, how do you think they thought about that person? Subhuman, yeah. Yes.
I think they still have like a feeling that it can be fixed.
Yeah. That they could cure or do these things. Do you think they thought the person was maybe dangerous to society at all? Or are they just not at all?
I think so. I think that they're out of control or that you couldn't trust them to be in a normal setting.
Mm-hmm. Yeah, definitely. Back then, like, people with mental illnesses were seen almost as criminals. They didn't know what to do with people like that, so they treated them like they were criminals. They didn't have any other options. So by the types of treatment, it was viewed as a bad thing, a physical illness, something that could be cured. So how do you think modern day treatments are different than what's being depicted here? So types of things do they use modern day that they wouldn't use here, or do they use these same types of
Now it's more like pills.
pills?
I think
Yeah.
pills can fix
Yeah.
anything.
Definitely. So this photo, what role do you guys think ethical guidelines played in treatment?
Doesn't seem like there were many.
Yeah, maybe not many.
Thinking of society over the individual,
Yeah.
or when deciding all this stuff. Progress over an individual, like, here's someone this way, and here's it.
Yeah, so if they can't cure them, whatever. Yeah.
I think nowadays we're a lot more delicate with people with mental illnesses, and they're just very not delicate.
So why would they use these types of treatments? If it's not ethical, if we don't do this now, why did they do it then?
Guidelines.
There were no guidelines. So what types of emotions does this bring out in any of you? Do you guys feel anything by looking at this and thinking about people back then, or?
I feel kind of sorry for them, what they were put through, because they would look to be, to have a disease, just because something was mentally wrong. I mean, it wasn't something they could control themselves, but they were being tortured for it, it seems like.
So, for the people who are trying to treat these patients, do you think that they have the best intentions? Like, do you think the thought was there, they were trying to cure these people? Do you think they just didn't care? They didn't want them to be a burden on society?
I'd say they were trying to cure them. I mean, they're obviously putting in effort to it, but I think they could have went about it a different way, more subtly, not so physical, and maybe even painful for the patients.
Yeah. So, like Heidi said, we didn't have the technology. There may not have been research back then. So how was doctors supposed to know what was best for the patient? How did they go about that?
Seem like these are like, this is like the experimental stage, like, it's more about what can come out of it than the actual person that they're.
Yeah. So what would you say as a justification, like what you said? Do you have any other justifications for this kind of treatment? Yeah, we didn't have research. So, in recent years, now we have turned to medicating people rather than treating them, kind of inhumanely. So, what I want you guys to do is think about that doctors have turned to medication as a fix-all, for not all doctors, but in some cases. So we began medicating our children, medicating children. How does medicating children now relate to this back then? So you guys can talk amongst yourselves more. How are they related? How are they different? Are they not related?
They're administered in similar ways, so like this is the first thing they go to, whereas now medication is the first thing you go to without trying, like, less precautions and like counseling or environmental control. Like the way that they're actually using is really is right. Use the first word is yeah. And that's I would assume children have a lot of input meaning for that medication. And it is this much in that in your treatment. There's so much, there's so many. Yeah. Bugs to be sure what the rest person is. That is what he's doing. That is a sometimes. But that's what it reminds me of. She was just concerned about.
Did you guys find anything common with talking to your peers? Did you find anything you guys kind of both agreed on, maybe didn't agree on?
We thought that children being medicated today maybe as far as much input in their medication as these people had in choosing their treatment. Someone made that decision for them.
I think the restraints are probably the same. I mean, not physically, but they're being mentally restrained with drugs. They're kind of altering their state, making them in a state of just lackadaisical, just kind of very lulling.
That's a good point, like for some people that is.
what about the element of choice? So parents forcing their kids to take a pill every day because they may suffer from ADD, ADHD, versus forcing, adults, children into these types of positions. Do you think the role of choice plays a role in that?
I think that choice, there may not be a choice, but then there's a different state of lack of choice with this, where I can assume that there was probably not that much progression from that state of mental illness to something that was normal. And for some people, taking that pill every day helps them to progress from a state where, they're not comfortable, everyone else is not comfortable, so they're not comfortable, to something where they can interact with people and they feel comfortable within themselves, so.
Time? Okay, feedback.